Great. Well, thanks for coming, everyone. So as I said, but now I can't change my slides. I promise I'm tech savvy, kind of. I'm gonna try this one more time. So, like I said, we moved really fast, did this really quickly. Really wanted to get something going for everybody as we're trying to figure out everything that's going on with House 1000. I know some folks in some agencies are working through that and kind of supporting it. Some folks may not be working very closely remotely to it. Looks like through the chat, there is quite a bit. So we really wanted to make sure that folks were getting supported in different ways and making sure that as we're hiring really fast and really quickly, I don't know if some folks are really new to this, some folks have been in it for a while, but that there were just some options for you to access some trainings and pieces that way. I may only really be able to have this really funny presentation just because I can't quite figure out the layout, which means now I can't see the chat either, which is a huge bummer. So, oh, nope, I hate that too. So for some background for me, I am Kelsey Anton. I work with Host. So I'm the Complex Case Program Officer here. I am relatively new to Host. I joined the department at the very end of May. So this is also a new position for us. It's really looking at how are we building those pathways very quickly with our really high acuity folks. So folks on the streets and in emergency shelters, accessing those services to housing, medical, kind of that whole pocket. I think when I describe it, I talk about our folks who unfortunately get kind of hot potatoed around from department to department, from agency to agency. We just see those folks really sitting in the same place. So I have been brought on to hopefully untangle that and create those throughways. My background, I was at Urban Peak for about 10 years. So for folks who don't know Urban Peak, we work with youth experiencing homelessness. I have been a case manager, I've been a supervisor, and left relatively recently when I was the program director. So have done this training in quite a few ways. So that is where my background is being pulled from in that experience specifically. And so stop me if you have questions and kind of what that looks like. Again, this is kind of very focused on that background and that, how I've seen relationships build in that kind of capacity and how that works. So for our agenda, we'll go over really, really briefly, kind of talk through progressive engagement and kind of how that relates to case management and how they differ a little bit. We'll kind of touch on the stages of change and motivational interviewing and how that applies to case management. For folks who are interested, if you saw it in that email, there is a motivational interviewing specific training that is happening tomorrow at, I believe, 11:30. And I'll go over a framework that I train on a lot. I used a lot. It's the Core 4 framework. Again, it's just a suggestion. It's a way to kind of frame the way you're looking at creating a case plan with somebody, but by no means is something that is the only thing you can use. I just feel like it's a really helpful tool. We'll talk about SMART goals for folks who know SMART goals or don't know SMART goals. How are we setting these goals up for folks walking away so they know what they're doing, you know what you're doing. And then we'll cover vital documents. I know vital documents are really challenging, really tricky to access and kind of figure out with our folks, and they can be real tricky. So we'll go over vital documents within the state of Colorado, and then we'll talk about how do we access vital documents from other states and what do we do when folks have no vital documents. So progressive engagement. So what we're talking here, we're kind of like thinking real front door access. So as we're first meeting somebody, they want to engage in some sort of level of case management, a relationship here. We're really looking at what are the resources we have available to us and how do we divert them from this episode or their first episode of homelessness as quickly as possible. I think the tricky part here is we know that the resources are very slim. That can be really challenging. We want to talk about, I think we want to untangle, do those folks have access to maybe permanent connections in another state? Is there a way we can reunite somebody with something that makes a lot of sense for them? Is there even something here in this state that could work to reunite with somebody? Those are just really tricky. We have resources such as rental assistance, rapid rehousing, rapid resolution, and other diversion programs. But again, we know that those programs and options are not always the easiest to access. Don't always have a lot of staffing, don't always have a lot of dollars. I think dollars are going to be the big one here. But as we're talking to this person and it becomes clearer and clearer, they've got maybe a longer history on the streets, longer trauma history, maybe some, other things going on legally. And it becomes more clear that those like really rapid resolution programs may not be appropriate or may not be even accessible to you. That is when it becomes evident that really trying to engage in that case management makes sense for that person, makes sense for you, and kind of builds those deeper supports for them so that we can kind of figure out how we're getting them to that next step. So at the end, if anyone is interested, I can let you know we have a program officer at Host on my team who is working the rapid resolution. So rapid resolution, as a really quick brief overview, folks can access a certain dollar amount to exit the situation. It's kind of seen as like a one and done thing. Can be used to pay for a down payment, can be used to try, going to a different state, trying to reunite with somebody. It's pretty broad in what that client can access, but it is a very specific agencies do hold those rapid resolution programs right now. This is a newer program for Host, as far as I'm aware. Trying to figure out how are we exiting folks who are pretty stable faster, and trying to like eliminate folks really sitting in that systems failure over and over again. So how are we moving some folks as quick as we can so we can intentionally work with other folks who need to engage in deeper case management. We do have a program officer here, Kevin Kelly, who I can connect if you have further questions, just because I don't work with that contract. Can definitely connect you if you're interested, but it just depends on the agency and what people have access to. So stages of change. I think stages of change and working with folks. It's an easy piece to untangle with case management specifically because it allows a lot of flexibility and breathing space for our clients and folks who are accessing services to really take ownership for the space in which they're feeling and where they're at. I think it also gives you as a case manager and the worker that space to also know we're not pushing our biases, we're not pushing our agenda. We're really trying to acknowledge where this person is and how we can acknowledge where they're at, and giving them that space. So, for example, we have somebody maybe pre-contemplation in an emergency shelter. Maybe we have somebody who comes every night, stays, but really, really hesitant about service workers, really doesn't want to talk to a case manager, just has a lot of trauma there. Um, how do we fit in? How do we encourage that person to talk through like what do they want to do? How could we build that relationship? How, do we ever see yourselves getting to contemplation where all of a sudden like, I think that I might want to work with somebody and I might want to have a good go-to, but like I'm not quite ready yet. What are some of those steps that we have control over and how can we support that person in that? All the way to somebody who who has worked the whole system, and who has like they have a case manager they trust, they have services they trust, they have action, they're like, I'm kind of sick of this. I have wanted to access sober living for a really long time. This is kind of what I want to do. How do I do that? And so as you're hearing these narratives and picking apart what folks are looking to write into a case plan and do with you, this is where that stages of change can be really helpful because we also know it's not linear, which is a great with this infographic. Just going around in a circle, just like we can slide and take a few steps forward, just like we can take a few steps back, and that's okay. Each day is super different. Each month is super different. Folks can be going through something pretty wild at any given time and just not be ready. Change for a lot of people is also really scary, especially with our folks experiencing homelessness, building community where they are, having a lot of that service burnout, a lot of trauma, a lot of mental health. There's just a lot of things that kind of stack up for folks. So this stage of change will help kind of empower as you're working through that case management, listening for that narrative and making sure that we're catching their narrative and not our narratives. This also allows for kind of that loop, where the spiral is in the middle. So we can also see we increase and we go through a whole action plan and we get to this next stage of our lives where that now we don't have to worry about our basic needs as much anymore. So our next step can be the evolution of what does my career look like? How do I engage in career conversations? How do I do something different? In the same kind of way, we can kind of slip and slide in that and slip and slide around the stages, if that makes sense. Any big questions on state of change or things that somebody wants to throw out there? So it does connect pretty well to motivational interviewing. So motivational interviewing for folks who have worked through it or have not worked through it, it lets the client dictate their service plan and their goals. Again, like I said in the last slide, like we just want to check our biases. This case plan and these goals are not for us to dictate and decide. Like we really want this person to be autonomous of their choices and kind of own that for themselves. So this is just really like we're sitting and active listening. We're asking open-ended questions, making sure we support that person and what their decisions are. Gives that space for harm reduction mentality too. So in the same vein, as we had somebody, let's say, who was very contemplative, like really like hesitant about engaging in case management, even really hesitant in engaging in much further services. How does motivational interviewing fit in? How are we asking the questions about, you know, do you feel, how do you feel safe at night? How do you know you can take care of your basic needs? Making sure that we're still kind of building in those pieces so that we can build that rapport, build that relationship, create those safe spaces. And then hear what are people asking for in resources? Are they asking for eventually getting to a place where they're asking for shelter? Are we asking for more access to mental health or behavioral health? Is it that I really want to work through all these other big pieces, but I just don't know where to start? This motivational interviewing component gives us a lot of tools in that way. If you're somebody who really, really likes acronyms and just like loves to follow little blips, ORS is a big thing. So it stands for open-ended questions, affirmations, reflections, and summary. Just because if you're following ORs or not does not mean you're necessarily doing motivational interviewing or not. But again, it is just kind of one of those tools that if you love to follow kind of a little bit of a script, that can help. At the end of the day, using Sage Change, motivational interviewing is just about building trust and relationship. We're really needing to create that safe space for folks to know that they're autonomous, know that they have control over their decisions, know that they're working their hardest and you are working your hardest, but they are equals in this conversation as much as you can make that. That is huge for case management and setting up an appropriate case management relationship. So here's another little blip on ORs and the stages of change and how they really merge together. It does help you as the case manager to create space for the client to make sure that they're being heard. I think a lot of times it can be really easy to make a lot of assumptions about what that person's trying to tell you, or assumptions about where they want to go, or things that you really wish for that person doesn't necessarily align with what that person wants for themselves. So making sure that this is creating space for that client to be heard. Confirms the underlying narrative that the person is trying to convey to you, helps you kind of take a step back, take a breath, and help summarize to make sure, oh, I'm hearing you say this. Is that accurate? Am I missing anything? Like, what would you like to have happen differently? That summarization piece gives you a lot of room for that to make sure, like, oh, you know what? You didn't hear me when I said this. And then we can kind of go back and untease it. And then it helps you better understand the stage of change that they may be in and how you can further support their goals. If they're really just basic needs, like really trying to just like figure out how to make it make sense, then that can kind of help you like untease what you need to do here. And as you work with them maybe and build more relationship, it becomes more apparent. But this kind of helps you move and see how we can merge the two, because the motivational interviewing questions, the open-ended questions that you're going to be asking, look pretty different per stage, but it's always just trying to get to what is the true narrative and what is the goal that you're trying to achieve. And take a second if there are any questions here or thoughts. Easy crowd. So some kind of key aspects as we're looking and kind of setting the stage for case management here, we just really need and want to be person-centered. That motivational interviewing will give you the tools you need to be person-centered. Stage of change, making sure we're using a harm reductive mentality. We are trauma informed. That is just all person-centered. Because we want to be as holistic as we can with access to supports and referrals. There are an abundance of referrals. There is an abundance of things that people would really like access to. And so your job as a case manager is really trying your best to keep on top of those kind of referrals, keep on top of the relationships that you hold with other professionals in the community, and how are we making those as seamless as we can so that when somebody, you can hear the story and hear the outcome, you know where to start moving somebody next. We really want to focus on housing first principles. Really, as folks get to that place where they are ready to access, like ready to start working on the housing plan with you, making sure that we throw as many options as we can into the housing options. That can be, the SPDAT, making sure SPDATs are done and into the system. That's, trying to get a better understanding of where their vital documents are, what's their work history, what is their legal history, like really trying to untangle histories here so that we know what barriers they may face, so that we can come across those later down the line, but really focusing on that housing first and making sure that folks have access to safe and stable housing, so that we can then untangle some of the bigger things. Because if we don't have housing to be safe and stable in, working on things like career goals and these lifelong ideas they're just not going to happen if we're trying to worry about where we're going to sleep every night. It's just going to be too tough. If
Kelsey, it looks like
somebody
there's a question in the chat if you want
sure
me to
is
kind of keep an eye on that.
Yeah, that would be great, Elizabeth. I can't see my chat
Sure.
anymore because I
Yeah,
am super illiterate today in PowerPoint. So
been there myself many
great,
times.
great.
So it looks like Matthew Reeds is asking, what is the best practice if the client is self-directing towards a path that is not helpful and not serving to improve their situation?
Yeah, I think that's a great question. I think my take on that is that it is still that client's decision, and that we want to really empower that person to take charge of their situation and what they're doing and what they're not doing, to kind of figure that out. I think what's really hard is how do we have those conversations with ourselves as the caseworker or whatever our exact position is. But if we're working in this kind of relationship building place, like where is our place to decide what is and isn't helpful for that person's trajectory and what is successful and not successful. I think we talk about that, I think, a lot in the homeless realm of like, how do you define success? And defining success looks so drastically different for every individual you come across. And so, trying to untangle that for ourselves, but I think I just like will harp on it time and time again. I really think it's relationship. I do believe that it's the depth of trust and relationship, that you have with somebody to be able to know that, like, we're moving on this case plan, and then something derails us, and then we're way over here, and then we're like having to start over, and that could happen like 50 times. I mean, again, change is scary. Kind of moving in different directions is really scary. I think it's really hard for folks to leave something that they potentially known for 10, 15 years, to do something different. So I think really allowing for grace, in that space, and allowing for our clients to have that autonomy to make it, and then just being there after, being there during, being there while you can, keep that relationship going as much as we can, and offering supports in the way that that they accept support. It's tricky though, especially in that relationship as we get closer to folks, and really want folks to succeed in their own case plans, and it gets really hairy. I know that. The last thing that I didn't quite mention yet, yeah, is that we just want to make sure in these case management sessions, and as we're talking with folks, that we're ensuring that all of our interventions are age, ability, culture, and gender appropriate. So allowing for folks to decide how they want to work with you, and what makes sense. We wouldn't really like work somebody who's 60, right? Maybe really hard towards like a career option or career goal. Unless they really want to, great. Like I will support you all day long. But if they're like, I would really like to focus on like this aspect of my life, we just want to make sure those interventions are really age appropriate, ability appropriate, whatever it all looks like. And that is just a pretty big component here. Any other questions? That was a good question, Matthew. And this just kind of goes into the same kind of just a visual for folks who are a little bit more visual learners, person-centered engagement model. I don't know if anyone on this call engages in the shelter providers call that we run monthly. So this may look familiar to you. I know they semi-recently did another kind of case management training So this looks like just making sure, again, we're kind of covering all these pieces. We're covering that engagement where they're at using a strengths-based approach with creative persistence. I think that creative persistence is really great. Just keeping tabs on folks, but not making them feel like we're like eagle eyes 24/7, like, hey man, you said you do this. Like, I remember that from 6 months ago, because that's also like, that doesn't feel good to me. Probably not going to feel good for the folks that we work with. We're using those motivational interviewing techniques, and keeping at person-centered planning, because folks who are in this situation, right, they are the experts in their lives. We are all the experts in our own lives, and folks who are asking and reaching out for support in this way definitely are the experts, and they will know what they want, and sometimes they don't necessarily know exactly how they want it or what they want, but at least like talking it through and having that safe space to understand it with you is huge. In the absence of coercion. So we would really want to take away any treatment requirements, no leveraging of services, no excess intrusive surveillance. So same thing, we don't want to like really tag on to them. Like, you said this one thing 9 months ago, why didn't you do it? Not helpful. Um, really trying to take away those barriers, as we're saying, I didn't, this person's obviously not interested in housing because they are not coming, like we said, one case management, they didn't show up, so they're obviously not interested. I think it's kind of having, and it's not quite coercion, but it's like having that space for things to happen and allowing for folks to have to work the cycle and maybe need reiterations over and over again, a different plan over and over again. But trying to keep that person-centered model in engagement and just trying to focus on what they're asking and what they're needing. So the core four framework. So this is a framework. So again, this is an interesting way to kind of look at case management. There are several different agencies here, several different ways that you all may have been instructed to do case management, may not have been instructed, kind of all still up to the agency. So I'm not here as like somebody from host to say you have to do it this way by any means. This is a framework that I personally used while I was a case manager and have found a lot of success in it because it organizes my brain really well and it organizes my thoughts, and helps just give me some categories without accidentally going like way above and beyond. So the core four is a usage thing. So the United States Interagency Council on Homelessness, they really are looking at, it started with youth, so it's Social and National Network for Youth, really looking at best frameworks and best practices on how are we ending homelessness, how are we creating these plans moving forward. So the big framework that they came up with was these core four. So it's seeing goals and outcomes in each of the four, which is well-being, permanent connections, education and employment sometimes will be teased out into two. I think then you have the core five, but I usually leave education and employment together, and then safe and stable housing. So they're looking at these four together need to complement each other and support each other for each person as they're working through a case plan, working through on their next steps to be able to be successful, to be able to be happy and thriving. I just really like this model, so that's how I always look through this lens. Um, so the first one is well-being. So I think this one to me is one of the easier ones. I think this encompasses a lot, but they can be very tangible outcomes. They can be very tangible goals. It's looking at how are we enhancing the well-being in relationship, to positive interpersonal and intrapersonal functioning. So areas of focus, physical and mental health are huge. Substance use, self-esteem, coping skills, any sort of psychological or physical safety. This well-being can just grow with us. I think, even all of us, I'm sure, in this world and in this stage of our careers have been through more self-care trainings than we can probably count. But it's really talking about how are we thinking about ourselves and how are we taking care of ourselves, but not just like in that self-care kind of way, not just in that. I like to meditate kind of way, which is really popular, that we give our folks those kind of options for mindfulness and meditation, but also how are we going to the dentist? Like, how do I know how to access the dentist? How am I taking care of dental care? Vision is a big one, right? I think a lot of our folks don't have, like, really are in need of vision care and don't have access to get new glasses. They lost their glasses a long time ago. They don't know what to do necessarily. So all of these pieces are building up to well-being and making sure that that person has the total physical, mental, spiritual kind of care that they have access to. And that's, again, led by them, but can be any sort of goal within that. I think as we're listening to this, I wonder if there are folks out there who would be comfortable going off mute and saying a few things that they think might fit under well-being that either we have talked about or like have not talked about.
I've got one for well-being.
Mm-hmm.
Working here in the safe outdoor space, one of the safe outdoor spaces here in Denver. Go away, raised hand. What I see that's so important to well-being is stability.
Mm,
Someone knowing where they're going to sleep every night, knowing that they can do their laundry and shower, and that there's water and coffee out, that the site's staffed and they can go there. Just like that consistent stability is so important for their well-being. It really put it into perspective for me, like, oh, hey, if my apartment moved every night, that'd be ridiculous.
right.
So
Right. I think that's a good one, especially like showers and laundry are so huge to your well-being as you're just physically you have to, you have to keep up with your hygiene, right? But there's also the component of like when you just know you feel dirty or you like you do smell, like these things in your head and you're like, how could I ever like I can't really talk to people. I can't go into these places. I can't like do the things that I need to because I feel unclean. I feel bad about myself. And so that's a great one, David. Anything else that somebody like that jumped into somebody's mind as we're talking about well-being? I will say well-being is relatively straightforward. Is one of them. Um, Yeah, building non-toxic. So that is actually, I think, also a great segue, non-toxic relationships, into the next one. So permanent connections. Um, let's see. Yep, social isolation is so huge. And so that is where these bleed into each other for sure. That's a good point. So looking at permanent connections, it is establishing those lasting social and community supports through connections with healthy, positive role models, mentors, families, and peers. So again, that's kind of where we're learning in the well-being phase here. We're learning coping skills, we're learning our boundaries, we're practicing those pieces for well-being because of our peer relationships that we are building in permanent connections. I think there is a really big component to my previous career and past life working with youth. Um, Pet care. That's a good one. Yeah, I would definitely throw pets into permanent connections. Um, I think like there was a definite bias that I personally had with folks living in the streets and shelters and their connection to family. And I would very quickly just assume, like, nope, your family must not be good for you, must be toxic. Like, my worldview just had to like exist in that way. And I really had to take that back from a staff standpoint and like really untangle that. And that's just like that is not the case for everybody. For a lot of people, it is. Doesn't mean that those relationships can't be rebuilt either. It doesn't mean that we can't revisit them. It doesn't mean that it's a permanent thing. But so those permanent connections aren't actually just physically your family. They aren't just your family, your friends. They also are really important ways on how do you access your family and friends. So areas of focus, constant access to communication, such as phones and email, I think are a big thing. Those are really important pieces to keep in touch, sure, socially with your family, but also how, as we kind of move into that education and employment realm, how are we filling out applications? How are we filling out our resumes? How are we doing these things if we don't have access to an email address that I know I can access? How am I doing this if I don't have a cell phone that can work and that I can access when I need to, and that I can pull up my information whenever I need to do that? So kind of, working through those goals. Where are folks at? Are they already have a working phone, they have working emails, they've got all these things, but they have no idea. They're super isolated. Maybe they just moved into their first apartment. Their friends are still in the streets or in shelters and they just don't know how to make a new group of folks. And so how do we kind of help combat that and how are we supporting folks through it? Um, Additional ideas for permanent connections. I love the pet thing. I do. I think we're seeing more and more pet care access for folks on the streets. Not a lot, but I think we're seeing more in the last few years. So I think that's really exciting. Anything else that comes up as permanent connections? I think this one trips people up the most, mostly because of that idea of a permanent connection has to be family or a friend. And, we know when it goes south, it goes real south. And how do we feel so really protective around those things and pieces? Um, Plants. Yeah. I think yeah, in the way where maybe a little bit back to well-being, but I think we also want our folks to take ownership and accountability and like joy in their first apartments or in their environment in their spaces. As they're moving in and creating that, we want to make sure like it's a really momentous occasion. How are people if they really want to get into plants? How do folks get access to plants? How do they take care of plants? How are they doing things like that? Same with pets, same with their wall decor. How are we creating those joyous moments through this case management? So I like plants. I'm a big visual culture kind of gal. So as folks really like to tap into that kind of stuff that they want to try that gives them joy, I love it. Yep. So I would say just any churches, sober communities, as folks have identified that for themselves. And, they're like, there's this church I used to go to. I've definitely worked with a lot of folks. The church I used to go to, I've really liked it. I haven't been back since being homeless. I'm like, maybe I'm really ashamed of it. I'm really like something went down, something happened, but I would really like to re-engage with that community. Can you help me? Or, somebody who feels very spiritual and they don't know what they want to choose and just they want to look up a few different places they can go and just kind of experiment with their ideas and meet new people and socialize in a different way. I think what I've done too that so I've seen a decent amount of success in is looking at meetups as folks can go to meetup groups. Those are just interesting because you can really target a very specific idea or excitement that your client has, something that makes them really jazzed about talking like nonstop, 24/7, and seeing if there's a meetup in the area, seeing how they can kind of engage in meeting new people that way if they're bold enough to want to go do it. I think it's a great way to help access different groups of people that folks probably didn't have access to. Local libraries usually also have a lot of groups that are kind of targeted towards very specific like games or very specific kind of topics that folks have a lot of interest in either learning about or deepening their knowledge in. So I think that's a great place to build some permanent connections. All right, moving on to education and employment. I think again, kind of like well-being, this is super straightforward, but I mean, we know in this work, it is very critical in the success and trajectory of how somebody finds themselves stable, how somebody finds themselves to be important, how do they carry themselves in that world. So this can look like formal education or training that supports the acquisition of jobs at a paying livable wage. I think, we know that if we're staying within even the larger metro of Denver, that gets very complicated and very wonky. But this is where we as case managers can really try to tease out what their full history is. So areas of focus are really big. What's their last level of education? Is it a GED, diploma, technical college, college? What are their career goals? And I think, this can be a fun place to talk about what's a career goal versus like what kind of a job could you just access right now? Because those are very different things. Like somebody can go get, maybe fast food left and right and do that all day long, but they despise the work. We don't want them to do something forever because they despise the work just because it gives them a paycheck. We want them to kind of bridge the gap to get a paycheck, but then focus over here. If it's, I've always wanted to be a nurse. I like really, really, that is my passion. That is my life's calling. So you as a case manager, how do we go from a nurse and work our way back? Like, what are we working with currently and how do we help get you there? So I think career goals is a big one for me. Previous work history is just good to know. Financial literacy, personal strengths is always really fun to work with somebody. Just kind of seeing again what jazzes them up and what they feel like, what are some of their interpersonal strengths? What do they see as their ability to, are they hands-on? Can they build things, take things apart? They know how to do every single mechanical aspect over here. They really love cooking and experimenting in the kitchen, doing something fun with baking. Like, what are their personal strengths and what gets them jazzed? Something important to focus on are IEPs and other educational supports that they may have had. I wouldn't say unless it shows itself evident for you all, accessing an IEP or like really digging into getting any kind of documentation that they would have had is super helpful. Usually it's not. I think it can be just listening to what that person's experience was and then trying to work through it. That can be the easiest way to do it, on those planes. So again, this is kind of where I leave education and employment really tangentially connected, just because they typically are. And how it is just setting somebody up for a lifelong success and untangling that and talking about it. I think a barrier that we can also come across here is legal backgrounds. I think we know that for a lot of our folks, that can be a big barrier. Financial costs, if I'm looking at getting, I really want to go to college or I really want to do XYZ, that comes with a pretty high price tag. How do we try to access some scholarships? But again, it can be a lot of work and a lot of digging. And so just kind of bracing our folks for that, bracing ourselves for that. It's not undoable by any means. It just takes a different level of work, and tagging in. It also really requires a special kind of, for education, access to internet, access to computers, technology, everything that comes with that. So making sure we're just kind of like really talking through that. What do have folks have access to? Where are they getting access to it? And trying to just really push on those for folks. Again, this is pretty basic, this one, but anything somebody would throw out there for education and employment that wasn't already mentioned? Well, moving on to the last one, safe and stable housing. So that's assuring safe and stable housing and that housing is sustainable over time. So our areas of focus here, can be shelter, housing, basic needs, staying with friends or family. We want to be making sure that we're doing those housing assessments, those SPDATs, as you get trained in those and as you're doing them. Sometimes host homes. I think host homes within the city are very hard to have access to. I don't think we have a lot of host homes. We have group homes, and those are also very hard to find and have access to. I think host homes are a really good resource for a few folks who are a little bit more rural. As a rural communities are seeing a lot more host home access. But I think this kind of relates to when we're talking, I think I mentioned stages change even in the beginning. Like, it's okay if our person is in contemplative phase, and really the biggest thing is they are so hesitant about moving indoors. And that first step to move indoors, maybe it's a safe outdoor space, maybe it's a non-congregate shelter, maybe it's just an emergency shelter, but that's their first time ever accessing that. That is safe and stable for them right now. And doesn't mean it can't grow as they go through the stages of change, but for here and now, that is a big growth part, and that is big for them. So celebrating and recognizing the smaller goals are also just as important. I saw somebody go off mute. I don't know if somebody wanted to throw something out there. This housing that's sustainable over time, a lot of that correlates and relates back to, right, the education and employment. How are we finding those jobs and careers that can pay people? But then how are we building in well-being? Because somebody's going to need coping skills the next time their boss tells them something stupid and they want to fly off the handle and quit tomorrow. Like, we're going to have to figure out. So all of these pieces are so interwoven and so intertwined, that is why I like using the core four as my framework. Really trying to identify maybe one goal in each, and maybe you're not actively working 2 out of the 4 goals, but somebody's like, yeah, I really want to work on making, like, I really want to find my cousin that I used to be really close with. That's a great permanent connection, but I'd really rather focus on my education and employment goal right now. So we've set the stage where there's something kind of over here, but knowing that they really want to focus on something else for them right now makes perfect sense. If you have somebody who's super gung ho and they're like, nope, I want a goal in every single like let's say you're using the core 4. I want to set 4 goals, one for each, and I want to just do it. Then I say, great. I think, you just take the lead of that person and kind of see what they want to do and how they want to do it. I think makes perfect sense to me, and giving them that support. So that kind of wraps up the framework specifically with core 4, before kind of moving into like case plans and ideas there. Anything else somebody wants to ask a question on or throw out there when it comes to that framework? All right, I'll jump over then to case plan. So before creating a case plan, we just need to know what the client needs and what they want. If you're following kind of the core 4 and looking at it that way, you probably have already done this, but we just need to assess for legal issues, especially for you to know, are there any issues that may impact housing? I didn't put it in there, but impact housing, but also impact your employment goals. What vital docs do they have? Do they have any? How are we going to get that if they don't have any? What's their education employment background? What non-cash benefits are they receiving? Are they SSDI? Do they have food stamps already? Kind of what does their benefits role look like? And do they have any behavioral or physical health needs that are not being met currently? This assessment, so again, like I say, this assessment, there's not like a tangible assessment, but you assessing that person in combination with that client's personal goals will help you build a service plan. So again, this goes back to you either personally or how your agency would like you to build case plans and service plans. It's all kind of up to you and that kind of realm. But that is the information that is just going to help drive the next steps in supporting that person, supporting their goals, making sure we're asking the right questions so that we're getting to the bottom of what their goals are, and that we can support that. And then following up. So SMART goals, I'm going to be super, super transparent. I don't love SMART goals because that's not the way my brain works. I know a lot of social workers who love SMART goals so much, and they would never deviate away from SMART goals. So again, personal preference, I think. If you don't know SMART goals, this is how we're looking at it for folks that we're working with. They are specific. So a specific goal, like I need a cell phone. I just need to go get one. Measurable. So how are we going to know when that goal is met? That one's pretty easy. I'm going to know I got a cell phone when I physically have my cell phone. Is it attainable? Yes, it's attainable. I know where to get go to the folks on the street corner for those phones. I know maybe I have enough to go to Boost Mobile and I want to do like a month to month, like whatever that it looks like. So yes, it's attainable. Relevant. I want to start applying for jobs. I want to get a house. And so I need to start being able to have a phone number for people to call me back. I need to call people. So it's very relevant. And then timely. How are we gonna what's the deadline here for this goal? Well, I'm waiting for one more check to come through from day labor. I think I could probably go to Boost at the end of next week. So that's pretty timely, right? Instead of like, oh, I don't know, I'll do it maybe in 2030, the year 2030, I will get a cell phone. Not super timely. We just want to set it so that it is within that relevancy and timeliness, it is accessible. So you could I know people who walk through each one of these SMART components with people on every single goal. Again, works for some people and it works for some of our clients. It's just not the way I personally live to do it, but I know a lot of people who do it that way. Keeps folks pretty accountable to what they're doing, especially if you're somebody who's giving that client a copy of their service plan. They're like, I want to walk away and know what my tangible pieces are. This can help just being very specific to the point, what they're supposed to be doing and when can be very helpful if that person thinks very linearly like that. So again, that's just kind of an option as you're setting those goals. Don't have to, but yeah. All right, so our next phase is vital documents. So before I move totally past the framework, the goal setting, the service plans, the kind of how are we finding ourselves here, any big burning questions? And we should have some time at the end too, if that's more comfortable. Okay. So vital documents, for folks who have already been in this work, I think you can know they are the biggest pain in they can be the most painful thing on the entire planet. So there's a lot of caveats to this. I try to just give the most basic information. Everyone's information, though, can look so drastically different. How to access these things I gave is kind of the bigger umbrella here. There are a lot of unique experiences, people who maybe were adopted from different countries, adopted within the states, have no access to family, have never had a single vital document in their life. There's a lot of really tricky components here, so I kind of gave the big umbrella of them. So specifically starting with Colorado. So let's say you have somebody who was previously issued a Colorado state ID. You can order it online, but you do need to know your ID number, and to have a mailing address. Oh, thanks, David. So you do need to have a mailing address. There are a lot of day centers that allow you to be a mailing address. I know Lawrence Street does mail, St. Francis Center, Senior Supports, Urban Peak, they all allow for mailing addresses, so that should be relatively easy. I think the ID number usually trips people up, or they may go in person to a DMV and they use the fingerprint. So we're all fingerprint scanned when we get our IDs, so we can go in person. They should be able to scan it and it should just pop back up. A lot of folks also do vouchers. I know Metro Caring used to do a lot of vouchers for IDs and birth certificates. I imagine they still do a lot of that. If your agency doesn't have access to it, that would be a good place to start, and kind of going from there. I've worked with folks. Oh, great. Cool. So I worked with a lot of folks too who take this. I learned from a lot of folks actually in case management. So one suggestion I would give is either for you to scan and upload a picture of their ID into the Documents tab under their account in HMIS. So you can just like reprint and find access to it. Again, you have to have permission from the client. But if they give you permission to do that, then you have access to their number. I've also had clients take pictures of their IDs and open if they have a Gmail account, open a Google Doc under their Gmail account and just put a picture of their ID in there. So it's like they can never lose it. And that's super helpful because then they can just find the picture whenever. They don't even have to have their phone anymore. They can just log into their Gmail at the library and figure that out. So I would highly encourage that as folks are trying to make sure that they don't lose their ID number. That's a really easy way to use it so that they don't have to go to the DMV in person. It's so much easier if you can just order it. Birth certificates. If they're born in Colorado, they can go in person or order on VitalCheck. It's vitalcheck.org or .com. I can't quite remember. Or you can mail in an application. So in person typically waives a bunch of other fees. So again, if you're an agency that doesn't have access to a lot of dollars for vital documents, this could be a really good way to skip the fee portion. VitalCheck usually charges a pretty hefty fee. I would say somewhere in like the $30 range, depending on the state. So if they can go in person, they should go in person. You do have to schedule an appointment right now. There is one in Glendale, off of in the Cherry Creek area. So schedule an appointment, but you do have to provide proof of identification. Your easiest thing is going to be a state ID. So if they can get a state ID first, that would be great. If not, they do have a list on their website. That you can kind of figure it out. To my knowledge, birth certificates do not work online. It's usually just at least the Metro Caring ones, I don't think does, because it's a specific kind of grant and funding that they have a relationship with. There may be others that I'm not aware of that do take that online, but typically the easiest way is if you're an agency that's able to pay for it up front and then just keep the receipt and do whatever billing you need to, that's going to be the easiest. I'm not sure I've ever used a voucher online. And then Social Security card. Only an in-person application, must prove documents to confirm your age, identity, citizenship, or immigration status. Again, an ID is going to be your easiest for all of these. They have a long laundry list of things on their website that you can do. They kind of, both of them, birth certificates and Social Security cards, break it out into one of these things or two of these things. If they don't have any of those, we just have to really figure it out. But I do know during COVID, you needed to mail your ID in to get your Social Security card, and I don't believe they do that anymore. But if anyone has updated information on that, that'd be great, because I know that was a big hiccup for a few years there for Social Security cards. All right, out of state, previously issued state IDs. Every single state is totally different. They all have their own rules, which I cannot seem to figure out who makes up what rules. I've ordered IDs from different states where literally my person had to know nothing. They just had to give their first and last name and they got their ID. And I've had states that just refuse to even entertain the idea to mail it. I would say in my experience, most states will send you the ID, but they will not send it to a different mailing address than is on their ID. So I would just ask the question just in case, hey, do you remember the address on your last ID? If you do, is it somebody that you still know and could they forward it to you? That's a little bit of a workaround here. Every single state, because it's different, just Google it before promising anything. That's just kind of your best bet to try to get it ordered. Same with out-of-state birth certificates. Some counties have a county-specific ordering process through their specific website. So I encourage, it's easiest to just go to each county specific and look it up versus automatically going to Vital Check, just because Vital Check can be complicated and very expensive. Just in case you can do a workaround, but if not, vitalcheck.com is majority of states. You do usually have to fax or mail in though a current ID of that client, so they still have to confirm who they are. If they don't fax it to the right place or on time, you usually get charged the processing fee and don't get a birth certificate. So it's good to just do your due diligence per state and kind of figure out who's going to ask for what. All right, pushing on time. Somebody who has never had any documents. They can set up appointments to the DMV and review a list of accepted documents. Those cannot be copies. Everything has to be originals. There's a lot of different things that folks will accept or the DMV will accept, but it is a long, arduous process. Worth it, definitely worth it, but they just got to stick with it. There are some things that can be helpful, such as school records, medical records. If your client is under the age of 21, they can get a parent or guardian proof and get their ID. Then that's great. We can pay, if you can pay for it and you can just get a guardian to prove, yep, they are who they are. That's going to be your best bet because once they turn 21, it just gets so much harder. Again, folks get really frustrated with the lack of documents and a lot of people can kind of quit midway. I would just really encourage that folks do their best because that's kind of their lifeline to working, getting an apartment, staying stable, just having access to ID is just huge. Colorado Legal Services also does a lot of vital document help. I would definitely check them out if you have somebody who's never had access to documents. Big help, and they can be really quick to work with. So just would suggest them. All right, I thought we'd have a little bit more time, so we have exactly 4 minutes. Are there burning questions, thoughts, comments, things that just kind of how folks want to go? And I can stop sharing since this is not the most helpful layout. Instead of SMART goals. Personally, I guess I just kind of did an iteration of SMART, just letting that person kind of dictate what their goal is, and then just kind of going back from there, when are we going to check in again about this, and what do you need from me to kind of make progress on this goal? And maybe it's an iteration where you have something like SMART in your head that you're kind of going through, but I didn't really write it out for every single person just because that felt like a lot. So there are a few other ones if you look out there, just there's a lot of different ways to write a case note. There's a few different versions if you kind of look up just service plan goals on Google, they can give you a few options. Okay. Oh, with 2 minutes. Thank you for coming to this case management training. Again, super broad, super vague, may be helpful for you, may not be helpful for you. I would really take this back and just kind of, simmer on it and really also use the supports you have at your agency who are currently doing case management. If I leave you with anything, it's relationship. And it's just relationship is the key that we need here. And it is building trusting relationships, listening to folks, and making sure that we're supporting their choices and that we're not imposing our choices on folks. And with that, any of those the big ones. I will throw my email in the chat. If anyone, where can we watch this training? I am not 100% sure where they'll be posted, but I do know that this training is recorded and going to be posted along with all of our other ones that we're doing this week. I would imagine it's going to be somewhere on the city's website, but I can follow up with you where it's going to be posted. Great. Thanks everyone for coming.